I backed out and found something else.
Communist! Communist!
Fine with that! Fine with
Communist
that!
rule!
Communist Health care for all! Health care for all! Health care for all! Health care for all! Health care for all!
Communism rules! Communism rules! Communism rules! Communism rules! Communism rules!
Care for all!
Communism rules! Communism rules!
Health care for all!
Communism rules!
Health care for all!
Health care for all! Communism works! Single payer system!
You guys keep walking off this block.
For single payers!
Whatever they
We hope for single payer!
It'd be nice. It'd be nice.
Well, let's make them vote for single payer!
Each of them speak and state why this issue is important to them and what they can do at the local level to try and impact the community in terms of providing health care for everybody. So, first off, I'm going to let Nicholas speak here. He's running for City Council this year. Nicholas?
Are you fired up? Yeah! Fired up? Yeah! Hey, thank you all for coming out today and standing up for such an important issue. Now this is raging on the national level, but this affects us here, right here in Cincinnati. Thank you for getting involved. The only way we're going to make a difference is if we get together and we fight for this. Are you ready to fight for this? Is this worth fighting for? Right.
What is this?
This is healthcare reform.
No, what healthcare reform? We want single payer!
Hey, say what? Hey, the way this works on the national level, it's tough. We know this is going to be a fight. Single payer maybe down the road. Right now, we have to be realistic. Right now, we have to fight for a public option.
Realistic for 30 years!
I know, hey, a public option.
We need some movement.
If we don't fight for this,
We have to be unified. We're all fighting for the same cause here.
We're not going to have
I'm not on the side of insurance companies.
Hold on. Hey, this is as close as we've ever come to healthcare reform.
That's
to
right.
true, meaningful healthcare reform. We have to keep it in our grasp. We have to keep our eyes on the prize and move this forward. Don't we?
Yeah!
That's right. And this issue affects us here locally. We talk about in Cincinnati, we have an infant mortality rate twice the national average.
That's right.
It's cheaper for people to go to the doctor and have a tooth pulled in the emergency room than pay for dental care. That's not acceptable.
right.
We have to fight for this. Excuse me, sir. I'm committed to fighting for this, and with your help, we're going to make it happen. Sir, thank you.
All right. Can you hear me? All right. My name's Anitra Brockman. I'm a Green Party candidate for Cincinnati City Council. First-time candidate. I'm out here with you all today because I truly believe that all people need quality and affordable health care. It is time for us, yes, let's get fired up because it's time for us to fight for what we need. We need quality and affordable health care to save our communities, to save our families, to save our children, and to save Cincinnati. So I stand with you all today and march with you all today because I believe in health care, quality and affordable. I hope that I can earn your vote on November 3rd, and I stand with Nichoals Hollan and Greg Harris. And please vote on November 3rd. A vote for Brockman is a vote for change in Cincinnati. It's what we need. Thank you.
Yeah. Thank you for coming. Greg Harris would like to say a few words here.
Yeah.
Greg.
My name's Greg Harris. I'm a member of City Council. I ran for Congress against Steve Shabbat in 2004. I advocated for universal Medicare. I wish that's where we were at today. But the next best thing is a public option, and we really have to draw the line there. We can't compromise. That's the only thing that's going to keep the insurance companies honest. Look, folks, 45,000 people died last year because they didn't have insurance. That's the equivalent of a Vietnam War, almost a Vietnam War in casualties every year. Casualties of this corrupt system. And the doctors are with us this year. Of course, the insurance companies are not. We have to reform healthcare. It is the human rights battle of our time. We are in a historic moment here. It comes every once or 2 decades where we have the chance to really move the needle and improve healthcare access for all. We can't squander this historic moment, otherwise it's going to be another 15 or 20 years. So this is the fight.
Right.
Woo! It is a corruption. You have to be born on third base to get first-rate health care in this country. That is an absolute violation of the American dream. I firmly believe that health care in this country is a right, not a privilege. I know you all share that view. So today we are marching together saying universal health care now. Thank you.
Yeah. Great. Woo! Thank you, Greg. I got a couple words to say here. I'll try to keep this brief. I'd like to thank you all for coming out today and showing your support for health care and health insurance reform. I know some of you support a single payer and some of you support a public option. But the fact is we can all agree that the system is failing us currently and change is needed. First off, it's worth noting the United States is the only industrialized country in the world without universal health care for all of its citizens. The only one. The United States is 35th in life expectancy in the world, behind Portugal, and yet we spend approximately $2 trillion per year, or almost $7,000 per person to provide that care, more than twice the amount of any other nation in the whole world. Our system is not the best in the world, yet it is by far the most expensive. The free market is not delivering competitive pricing. The private insurance industry has one of the only exemptions from antitrust laws in the country. This needs to stop. Administrative costs account for 31% of all healthcare expenditures in the U.S. That only means 69 cents of every dollar actually goes towards taking care of actual medical care delivered. We subsidize this system already. We are not getting our money's worth. There are 4 times as many healthcare lobbyists in Washington as there are members of Congress. We need our elected officials to answer to our needs. We have over 9 million children lacking health insurance in the U.S., even with CHIP providing coverage. 62% of all bankruptcies are caused by medical bills, and 3/4 of those filings are people who have medical insurance already. America is also the only industrialized country which allows private insurers to make a profit off of basic medical care. Once again, I want to thank you all for coming out today. Remember to contact your elected officials, let them know what your opinions are. Keep this positive, not stick to name calling the other side like to use. And remember that, yes, we can. Y'all fired up? Fired up! Yeah. Ready to go for all! Health care 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 for all!
Health care for all! Health care for all! Health care for all! Health care for all!
It's not my fault, actually. I think so. It's the creative part.
Pharmacy companies continue to make outrageous.
And so with the public option, it begins down the line.
These are good.